national system, maybe in Slovakia, maybe the greatest problem, what is a problem also in Europe, is the aging population. If you can see the trend from 1961 till 2000, it is growing 2%, 66 people, 66 years old, 65 plus, are growing 2% more each, almost each 5-7 years. And the trend is that now, from the census 2010, we have more than 20% of people 66 plus, and even the population grew from 5 million in Slovakia to 5 million 6. The 66 plus made is growing, not the new child born. So the government now tries to do two things. One thing is how to take care of these aging people, and the second thing how to support the newborn babies and do something in social care for this, so that the birth is better in Slovakia. What we are what is the challenge in outpatient care in Slovakia, that we have something like two systems, and there is a healthcare services and there are social services for these people who are either disabled or aging. And healthcare services are paid from the insurance, healthcare insurance. The payment is from healthcare insurance, and the social services are paid from social system. And two ministries and two systems are working somehow next to each one, and it makes sometimes great difficulties. So, for example, if you have a diabetes and you have to have your leg, you have a complication in your leg, and the leg must be cut off. So the healthcare system, it makes it very easily. Then you stay in social system. For healthcare system, it is very difficult to find money for prevention, so that this state doesn't happen, because the operation is cheap one, so it is better to take you the leg than to invest the money to prevention and to monitoring this, or making catheterization or these things, so that it doesn't happen in the social system. Then the person is socially disabled and also doesn't pay the social to the social system, but the healthcare system it is not interesting. So but the end result is that the state budget is imbalanced in this. So in healthcare services we have sanitary for long-term care. They are usually in the hospitals. When the beds are changed into long-term care, it is a little bit cheaper than normal bed. Then we have still growing agencies of home care nursing, because we have 18,000 people in a waiting list for social or healthcare services who are disabled or who are aging. So these agencies are growing. They are maybe more than 200 today, and they are paid. The expenses are covered from healthcare insurance, and these are agencies where mostly the medical care is involved, like injections or medical technical. Then we have in palliative care, we have mobile hospices and hospices, and house of nursing or medical institutional. In social, we have daycare or monitoring and signalization of need. Then houses of social services, retirement houses, protected living or houses of daycare, and they are reimbursed from the regional government budgets, but from the social system. And now we have at the adopted a new law, new legislature, because the social services institutions used to be paid unequally. Private were received only 20% and other 50%, so now it is somehow leveled so that each regional unit can decide how much money will put into the social services. And when you are in social services and you need the healthcare services, so healthcare service is free of charge, but social services is paid. Or when you are in healthcare system and you need also the social services, so you pay more. So sometimes in home care it can happen that you have the service from others agency, from healthcare services, and also from the social. So two people practically are in charge of you. So this is the system. And the healthcare services are usually the nursing sisters are trained in a normal university training. It is bachelor level or master level, but social services are only the courses that last maybe 600 hours, and maybe the social services are not still utilized properly because there are more institutions maybe than they are needed in Slovakia. Maybe some social care should be given for home care, because people in Slovakia still prefer to have the home care service and also nursing. So this is probably the field that have to be developed more in the future. So this is from me.